Thank you all so much for choosing to join us on your Friday morning or afternoon or evening or Saturday morning. You know, there's so many incredible things happening at RightsCon, so we're grateful that you chose to spend a little bit of time with us here. So I think everybody should be rolling in within the next couple of minutes, so we can do you know, a brief introduction to this session. We can do kind of introductions with all the panelists that have joined in. We have a bit of an exercise, which we'll paste a link to a Google document into the chat, which everybody can contribute to, so we can learn a little bit more about the folks that are participating in this session. And then we'll have a group discussion, a bit less of a formal panel and a bit more of a group discussion, so that we can you know, ask each other the questions that we have about one another's work. And yeah, we'll start with that. So I will start by summarizing the session that we're all here for today. So welcome, first of all, to Content Moderation, Counterfactuals, and the Right to Health. We're grateful to be chatting with you all and discussing amongst ourselves and learning from one another about an issue that, you know, has increased in salience globally over the last year, but by no means is this the beginning of when such questions around content moderation and public health have been you know, beginning to be asked. This the concept of public health, while especially over the last year it's been largely referred to with reference to COVID-19, has so many other facets embedded in it, and so many you know, intersections between the right to health, access to information, and how it, you know, disproportionately affects folks around the world, and with a variety of health conditions and comorbidities and, you know, socioeconomic factors that may play into how those get expressed. So this specific session is an invitation to reflect and to share understandings of the decision-making processes of health-specific content moderation decisions. So the case examples that are integrated into moderation policies, those that are not, and how it affects different populations. We'll discuss the removal of content online, censorship of content or actors, or bans of content, which is particularly challenging to address for health topics, where the ethical issues of providing access to care and the information that people need may conflict with freedom of expression. So this can be compounded in countries where there are higher levels of stigmatization or criminality of healthcare services, such as reproductive health and rights. So we'll begin this conversation by examining existing content moderation policies that have emerged throughout 2020, especially in direct response to the COVID-19 pandemic, and the ways in which they support the right to health. And then we'll explore some specific case studies in which similar avenues to realizing the right to health were compromised, or perhaps exacerbated by limited or a lack of content moderation support for those health events or topics. And panelists will share insights about case studies that can kind of illuminate the pertinent challenges of the intersection of public health, content moderation, and human rights, such as how misinformation contributed to the withdrawal of the reproductive health bill in Kenya that took place during the summer of 2020, the role of stigma in delayed access to treatment and care, and transgender rights and access to healthcare. So with that in mind, we're super lucky to have this incredible group of folks, and we'll go around, introduce ourselves, and then Kat, if you can paste the link to the Google Doc that folks participating in can contribute to in the chat, that would be great. So I'll start, then I'll pass it over to Catherine, then to, sorry, I'll start, then I'll pass it over to Arya, then Catherine, then Kat, and then Mugendi. Thank you again, everybody, for joining in. My name's Nat Jennis, and I'm the director of a research unit called the Digital Health Lab at the technology nonprofit Meedan. And we conduct a lot of applied research at the intersection of health information access and equity, and the role that kind of digital media platforms play in mediating access to health through access to information. And with that, I will pass it over to Arya.
Hey, hi everyone. Yeah, so my name is Arya JP Carrijo. I am currently working with Ooze Knowledge, and Ooze Knowledge is a global campaign that centers knowledge from indigenous, well, from marginalized communities, which is like the majority of the world when it comes to the internet. Yeah, other than that, last year I worked as a feminist investigative journalist for Open Democracy. And a lot of the stories I'll be talking about today were stories we did then. Yeah, and I'm also active in LBQ women and transgender organizing in Kenya. And yeah, I'm also a trans woman in Kenya. So yes, I'm helping organize for my community. Thank you.
Hi, my name is Catherine Gisheru. I'm an ICFJ fellow and the director of an initiative I started last year, which is called the Africa Women Journalism Project. The project is essentially committed or the objective of the project is to support female journalists in Africa with mentorship, training, and grants. And the reason for this is because, as you know, in most countries in the continent, women in the newsroom is like getting women to stay in newsrooms and rise through the ranks and become the people who are making decisions is a big problem. So the objective of, AWJP also supports these women journalists by giving them grants and helping them report on underreported issues, as well as amplify the voices of minority groups in the continent like ARIA, as well as others, because there's a whole gender where women are in they're in the majority, but we don't get to hear their voices. We want to strengthen the voices of women journalists so that they can become innovators in their newsroom, as well as amplify the voices of those marginalized groups within our society. And in the process, hopefully some fantastic. They're actually doing fantastic journalism, public service journalism. That's me in a nutshell for now. So over to you, Kat.
Hi, I'm Kat Lowe. I'm a content moderation lead at Meedan. And I've moved from doing a lot of work with targets harassment, specifically marginalized groups that have been disproportionately targeted online, and helping them through online crisis situations and navigating content moderation through reporting forums. And I'm doing a project with reflecting those experiences better with PEN America. And at Meedan, I'm working with civil society groups how to better advocate for themselves through content moderations and working with social media platforms and using social media platforms and thinking about both how to manage people being silenced or organizations being silenced through harassment and other kinds of attacks through online spaces, as well as how they're marginalized by the content moderation themselves.
All right, and I'm Eric Mugembi. I am the program manager for Sub-Saharan Africa at Meedan, where I work with a number of organizations, including the Africa Women Journalism Project, where Catherine is from, and a couple of other organizations to support the work they do on the continent and in some of the countries that have experienced a lot of challenges in terms of making information freely and openly accessible. And then I previously worked as a managing editor at a fact-checking initiative, where one of the things that I was in charge of was trying to figure out where that kind of intervention worked best and how to come in and make sure that the information people are consuming in various ways and in various spaces is actually authentic and legitimate. Yeah.
And, with so many different perspectives towards the issues of kind of intersecting public health and content moderation, hopefully we'll be able to get, a diverse set of perspectives on some of the implementation of content moderation policy, some of the challenges with them, and sort of where we can go forward from here, especially with reference to public health challenges. So I might turn it over to Kat to just quickly describe the form that the link that we've pasted into the chat that hopefully everybody can have access to introduce yourselves.
Yeah, so I've put the link in the chat, and essentially we first want to encourage people to introduce themselves, the organization that they're coming from, so we understand the perspectives of people who are interested in this topic, as well as talking about how you yourself have encountered public health issues through social media, as well as your own challenges with content moderation. So just feel free to pop in the document and enter your perspectives into the bullet points there. And at the end of the document, make sure to put your contact information if you want to, explore some collaborations or be in touch.
Awesome. So this is the perfect time to begin the discussion. We all, have in some capacity, whether in, WhatsApp groups with our close family members, or, when scrolling another social media platform or through search, have encountered the variety of, levels of quality of information that has been shared through the COVID pandemic. We've also been, exposed to situations where information, especially related to COVID-19, has been, changing over time because of new and evolving evidence that, changes and recommendations for policies. And this kind of changing public health research and information ecosystem is not new. Of course, it's the process of scientific investigation, and it's occurred for a variety of other public health topics. And, increasingly, when there is the idea that there's kind of a general ground truth or consensus towards especially a public health topic that might impact populations in terms of public health care seeking behaviors, delayed care seeking may result from misinformation, or unintentional pursuit of treatment pathways that are either irrelevant or harmful for a particular population. All of these we now need to encounter in our social media spaces where, that's where we're spending our time. That's where we're getting some of our information from. So I'd love to start this with Kat, if you can share a little bit more about what are sort of the different approaches and content moderation policies that have been implemented through the COVID-19 pandemic.
Sure, yeah. I think I want to start with pointing out that social media platforms have to navigate the tension between appropriately managing a huge influx of misinformation and hate related to COVID-19 with the challenges of basically taking down counter speech and other kinds of interventions that are important for debunking misinformation or decreasing vaccine hesitancy and other public health outcomes. So there's a long list of a lot of different things that social media companies have done. And one of the first ones that I think people are often most affected by are algorithmic solutions, algorithmic detection of content, algorithmic attention towards sharing habits. And companies have claimed to be doing this kind of work for a long time. In 2019, for different misinformation about cancer treatments or vaccines, they ended up saying that they downranked content or started algorithmically detecting to remove some of that content or put information screens or misinformation oriented labels under them to say, well, here's the Wikipedia article for this issue. And so now social media companies are being more proactive around not just detecting through algorithms to put a label on top of it, but they're more proactively taking down this content rather than these softer measures. They also are, and I think as a caveat, I want to say they are, or they're claiming to, because there aren't necessarily a lot of ways to audit how these interventions are actually working in practice. But in terms of these information labels, a lot of them, instead of, say, links to Wikipedia articles, are now links to World Health Organization resources or fact-checking organizations. And so they're very much more targeted towards the content that's being said through these basically through different kinds of content. And top of that, the interventions or the labels or screens in front of this content have a bit more nuance in how they're defined. Rather than just saying this is false information, companies are now invested in saying this is misleading or please learn more about. And I think they're thinking a lot more carefully about presentation of debunking or causing people to think more carefully about the information they're sharing. They are working with the WHO and other organizations like the CDC and other local public health authorities to kind of track how things like sharing, vaccine hesitant content and so on, how it's changing in relation to these interventions. This information isn't public, so it can't necessarily be audited, but within these companies, this is what they're saying that they're doing. They are now, these companies are now doing things like limiting influencers or hubs of people who are sharing misinformation consistently, rather than just looking at the content themselves or a specific instance with an influencer. So they are developing more sophisticated methods for detection. However, they are also developing much more aggressive methods of detection, and not having fewer resources allocated through like manual content moderators to actually navigate appeals processes for people who are in many cases doing counter speech around misinformation. I think on top of that, with WhatsApp and Facebook and so on, they are finding measures to limit viral sharing habits so that people cannot share things at like a huge pace that's misinformation. And spaces like Twitter or social media platforms like Twitter are kind of introducing multiple steps for somebody to share information. And so they've already implemented a lot of these measures because of the US presidential elections, but they are now doing this in the context of COVID, where they ask, it seems like you haven't read this article, do you want to pass this along? Which in many cases is difficult for people who have limited data plans, and so they can only engage with this content through these headlines. But you can see that they're not just implementing what we think of necessarily as reactive content moderation methods in terms of just takedowns, but very proactive measures of labeling content and sort of more educational content that might be seen as less confrontational and might have fewer consequences for unjust takedowns. However, it doesn't necessarily mitigate the fact that they are more aggressively taking things down through identification, through algorithmic systems, and people reporting things potentially in bad faith, where it takes a very long time for content moderators to actually navigate those appeals, which on top of, they don't necessarily have the tools to evaluate the context around these appeals. And one positive step for content moderators in general, and perhaps some of these algorithmic solutions, is that companies are now making much more precise policies around COVID misinformation. A lot of the times, policies around misinformation are entirely absent from their policies, or it's very non-specific. So now what you see in these policies that a lot of these social media companies have are literal lists of misinformation and statements around, vaccines, the spread of COVID, the implications of COVID, and which I believe is connected very much to the information and the manuals that content moderators have for evaluating these statements. So in a sense, this kind of intervention is what we hope a more integrated, is more integrating experts more in determining what these policies are and how they're enacted. But again, it's very speculative in terms of, are these claims that they're making actually being followed through in practice? But these are many of the interventions that they're doing that they suggest that they haven't been doing to this extent before.
Thanks so much for sharing that context with us, Kat. I'm sure, there are a number of different kind of context-specific, either public health challenges or issues, health contexts that may have disproportionately affected communities in some ways more than COVID-19 has. So having this kind of case study that COVID has provided us, which is, what is possible for content moderation when there's yet evolving and continuing to evolve scientific ground truth, but can still support communities. What does that look like to expand towards reproductive health and rights, for example, HIV misinformation and the impact that that has on delayed care seeking and stigmatization, and beyond. So hopefully we'll be able to touch on a couple of those case studies through this panel. I wanted to open it up. You know, we'll organize this as a bit more of a conversation. I saw Catherine eagerly jotting ideas and thoughts down, so I might start there with, you know, what should we be doing? What should we be thinking about? How should we begin?
When Kat was talking, I was saying what they're saying they are doing and what is happening on the other side. Like they say that this is what they're doing, all the different ways they're trying to moderate content. I was just shaking my head because I was saying, maybe they are saying they are doing this in another space and time, but not in our zone or in our time and space, because there's so much let me just talk about one of the things which was bugging me, because when it comes to pulling down or labeling content as misleading, and you have a whole, the way they are making that, or the way the platforms make that determination, whether it's through algorithms or whatever, whether it's human content moderators or whatever flagging stuff. But I cannot understand how, for example, they would let stand a whole bunch of misinformation around vaccines. And I'm not talking about COVID vaccines, but I'm talking about something like HPV vaccine or the tetanus vaccine, which was the misinformation was shared by the bishops, and everybody kind of tried to push back at them, but it's still standing even now. And the bishops, the Catholic bishops, were against it, saying that the tetanus vaccine has got, what do you call it? Contraception. The same thing with the HPV. And there's that resistance. When that information is shared by an authority like the Catholic Bishops Association, we do look up to our religious leaders, and it's led to stand. And the attempt or the attempts to try and point out that this is not true, that it is misleading, is downgraded. So when you do a search, you actually see the bishops, but you don't see what Mugendi has done to debunk that and to point to. So I'm kind of feeling as I get a sense that sometimes the prioritization or whatever it is that is being used to kind of moderate this kind of content is not applied with the same force, or it doesn't get the same urgency if it comes to some of our regions. And I'm not saying, I mean, just the fact that the bishops say this about the tetanus, they've said this about HPV. There are some other, sorry to use French, there are some other people who've actually said the same thing about COVID. There are people saying the same thing about the COVID vaccine. And that, for me, is contributing to the hesitancy that we've seen when you look at the study that was done in December, where people are saying, yeah, we are all for, at least Africa, most of the African countries that were surveyed were saying, yes, we are all for the vaccine. And this was long before the vaccine came on board. But now when they did a similar survey in January and February, guys are like, yeah, we're waiting and seeing, because of all this madness that has been allowed to fester. And yet it is circulating within our ecosystem, which for me, I think it's not the attention that they say they are paying to it, especially around COVID, doesn't seem to be reflected in the actions, either the takedowns, the labeling, or the whatever they need to do to be able to tell people, okay, guys, think twice. This is not, we've checked, we know it's not true. I just get, yeah, sorry.
No, that's exactly one of the challenges I think that you highlighted, is how intersectional public health trust and mistrust in intergovernmental institutions, in public health intervention design is, because they are so intersectional. You know, when you're addressing content moderation issues and focusing on a COVID-19 vaccine with specific proper nouns and key terms associated with COVID-19, what is all the infrastructural misinformation that you're missing that you know, has contributed to either mistrust or, you know, shifts in perceptions or delayed care seeking, which leads to a higher burden of disease for a variety of other health topics that are intersectional. And that's, you know, really where community organization, fact-checking organizations that understand the context-specific, in essence, public health challenges and how they intersect with one another really need to play a role. I was wondering, actually, Arya, if you have any specific thoughts from kind of a community activism perspective. Oh, we're missing you. As usual on a tech panel, there's always something.
Wow. Yeah, so I was saying, I think it's interesting when Catherine was speaking about the instances of you know how the misinformation on vaccines has been spread, and how some how it's possible for some bodies of organizations or communities to be able to pass through misinformation, either through social media or even inactively in journalism pieces without being flagged. And kind of for me, it made me think about you know, the 80s, when there was this whole rise in anti-abortion, and you know, the Reagan government in the US. And in those days, what used to happen, this anti-abortion religious group mostly used civility to get the information across. So everyone was like, oh no, these are church groups, they're good people, so this information has to be from a caring point of view, for humanity. And I think this kind of perception has just stuck, especially in Africa. And for me, it's sad because last year what we saw, so I'll give a couple of examples. First, when after some months in COVID and quarantine, there was the Kenya Health, a government survey showed that there was like 4,000 girls in one of the county who were impregnated. And then further looking into these cases, it seemed it was either older family members or men in the community, just because these girls were not in school. And there was a whole discussion around, you know, should there be, is this a case for we need comprehensive sex education in schools? Should we be enforcing better laws on you know, against sexual abuse? Like, should the Sexual Offences Act be enforced better? But then there was also pushback by this religious group saying, no, this is trying to introduce, and they always fall back on this Western culture. This is an attempt to introduce Western culture to, you know, to our children. And this kind of rhetoric has grown old. And when most journalism houses and news production houses do not delve deep into the story, so they pick the sensational bit and then run with that. So with the story for the pregnant girls, they just picked that, and the numbers are blown out to 152,000 in the country. And there's a huge debate around that, but no one had addressed the root causes, like girls are not receiving comprehensive sexual education, girls are being abused at home by their fathers and possibly other male relatives. And also no one linked that to the abortion debate. So again, the COVID year saw Kenya having the reproductive health bill go to parliament, and you know, churches actively attacked this bill on social media. So if you look at the social church led by Pastor Kavi, they had like Facebook posts with formats for how their church members could talk to parliament in order to take down this reproductive health bill. And well, pre-COVID, I mean, the same church had a full billboard in Nairobi city opposing, you know, like abortion. And these are things with, and we look at these things, it's very funny because real medics would put up like factual information on a billboard would actually be criticized. Or if a real medic actually said, you know, this abortion is important for these girls because 98% of them will drop out of school, 9% of them die in childbirth, and like almost all of them lose these children. Like, it's really young children who have no idea of even exactly what they're carrying. But, and the thing is, but this whole fear of religion and culture, the real medics will just sit back and let all these people posing as medics and well, I mean, they use a lot of them use their medical qualification to push their religious agenda. And so you'll see someone saying, oh, we are the Kenya Christian Professionals Association. And they'll put up a campaign against intersex people, or they'll do something against the reproductive health bill. And so the outlook for the regular Kenyan is, oh, you know, they're professionals. And no one is questioning, you know, they're not using a professional angle to talk. They're using their religious beliefs to address, and the professionality as a cover for that. And the saddest was when the COVID vaccine was out, and the Kenya Catholic Doctors Association put up a whole public statement saying, you know, people should not have the vaccine, and they alleged that the vaccine was being led by Bill Gates, and Bill Gates is wants the African population to be decimated, and so you should not have the vaccine. And the post ran for a really long while on Twitter, and the only counterfactuals that were happening were Kenyan Twitter users responding and saying, oh, you know, the Pope and the previous Pope have received their jab, so why are you asking us not to get the jab? And so when it got to that point, now the Catholic Church responded and was like, oh, you know, the church and the Doctors Association are different. And so as a church, you can go ahead and have a vaccine. The doctors were expressing their different opinion. But the fact is, throughout the couple of weeks, the church was silent and kind of passively supporting this message. And for me, the sad bit is, you know, medics don't take up that whole space and say, you're talking about a medical issue and these are the facts. And even if you are a medic like one of us, but you're not using the medical facts, then you have to acknowledge to the public that you're speaking based on your religion and not out of your medical practice. So there's no one taking a strong stand on these issues. Whenever anyone speaks up as a voice for religion or as a voice for culture, everyone else backs away because they don't want to be seen in bad light by society. So yeah, I guess that was like really the first thing I noted during the pandemic. I think COVID helped bring these things like really to the fore, and especially in this region in Africa, where like those two countries which are like, you know, we're not gonna mask up, we're not gonna quarantine, we're going to depend on God to keep us safe. And it was just messed up. So this was Burundi and Tanzania. And yeah, I mean, both presidents have now passed on, suspected of COVID-related causes. But it was sad that they put the whole population through such, you know, an experience, and no one will stop them because they're speaking up because of God or because of our culture. So yeah, for me, that was the big part of some of the sad things I saw during COVID.
Yeah. I think you raised, you know, a number of really interesting and incredible points. One of them, you know, being the idea that kind of what is the most sensationalized or the most sensational is what gets covered. And in a public health context, you know, one of the important things to keep in mind is that a public health win is a non-event. Like when nothing happens, when nobody knows that there was, you know, a small outbreak that, you know, didn't spread to other populations, that's a public health win. So kind of this, you know, publication, you know, sensationalized headline is sort of the opposite of what a public health win means. And I think you also highlight the really important role that, you know, civil society actors, that fact-checking organizations can have in, you know, making sure that the misinformation that may not seem as sensational or as you know, stark or have, you know, the headlines that can catch people's attention is still important health misinformation to address because of how it may disproportionately affect a segment of the population. And I actually wonder, you know, Mugendi, if you can speak to your experience in specifically in fact checking about what it means to cover and make sure that the misinformation that may not be sensational, but is still really important to communities gets covered. What's the role of fact checkers in doing so? What's the role of civil society organizations in doing so? And making sure that those health topics can be flagged for more equitable moderation.
Yeah, thanks, Nat. So first of all, I think it's really important to point out that a lot of the organizations in some of these situations are like a really good point of contact for, especially for someone who's trying to figure out what kind of false information people are falling for. Because a lot of times we see these things, the like networks of trust, where if you get information, if you get credible information from, or if you get false information from someone you trust, if it's like a religious leader or like a family member, sometimes it becomes really difficult for you to, or for someone who's been exposed to this false information to like unlearn the false information and then replace it with factual information. And that's how, I think that's the thing that Arya pointed out, that a lot of religious organizations and religious institutions have become channels through which false information gets spread because there's that assumption of credibility. So I think for civil society and for fact checkers as well, it's really important to establish like a relationship with the audience so that they know who you are and they know like you're not just saying this, or you're not just saying something because you have something to gain, but you genuinely want them to consume credible information, and you want them to understand that this is how they can do this for themselves. Like you want people to be able to discern that not all the information they consume is credible, and then you sort of give them like the signals that they can then use to determine the authenticity of information. And the other thing that I think, especially for fact checkers, is really difficult is just trying to move faster than the false information. Because a lot of times you'll find that a false story or like a false post will show up on WhatsApp, and then the fact check comes by like 2 or 3 days later, by which time like the false information has already gone viral and a lot of people have seen it. And then it's the fact checker's job then to undo that damage and then like replace it again with the credible information, which can feel very, very pointless sometimes, because you will come in and then you'll tell people that this is the authentic kind of information, and then it becomes your job as a fact checker to explain why the information they consumed is false. By the time the person who created this false information has already moved on, and it becomes really difficult to do that. So I think it's really important to just acknowledge that the way people consume information it's really different, and it's really hard to find a lot of, because previously with legacy media, you could count on the fact that everyone would like gather to watch the news or to listen to the radio or to read the newspaper. But now everyone is consuming information in their own space and at their own time. So it's really difficult to determine exactly what kind of false information people have consumed. And then you also find that sometimes there's that vacuum, there's that the knowledge gap that exists, especially now with this pandemic. There were a lot of times when there wasn't like it wasn't moving quickly, like there wasn't enough time that was, so there wasn't enough information that was coming up, but then at the same time people are still sharing and information is still circulating, which is why like very early on we saw a lot of the stories that were going viral were voice notes from religious leaders talking about how 5G is responsible for this and it's not a virus. And then eventually they went round and round these voice notes, and then now that's when the scientific community decided, yes, we need to act. So I think there's a need for like closer linkages, and I think the pandemic has really brought this out, the need for more open communication between the scientific community and the people consuming this information, and the scientific community and fact checkers as well, because fact checkers may not necessarily be scientists, but it's their job to communicate the scientific information. And then also in situations, in sensitive situations, we've seen sometimes the scientists will need like sort of like an indicator of exactly what the impact of this false information might be, because to them it might be that this is just something like it's nothing, it's a non-issue, but then it's causing like a lot of harm. So we saw this especially with the reproductive healthcare bill that you previously mentioned, where one of the things that came up was a policy essentially to regulate the space of providing reproductive care to adolescents and to people who generally need this kind of guidance in that space. But then what ended up happening was now the religious fanatics almost, they came in and then they hijacked this conversation, and then they decided it's going to be about abortion. And this is the bill that they said is being used to drive the abortion agenda. And because of this misinformation, the bill eventually had to be withdrawn. And what ended up happening was the sponsor of the bill said they had to take it out for further consultation before it would be reintroduced. But actually looking at the bill, you could see that one of the things that, because abortion is already legal in certain circumstances according to the Constitution, but the way the misinformation around this bill was being framed was that the bill would make abortion on demand legal, and a medical practitioner would not be able to claim religious exemption if they didn't want to provide an abortion. And then there was a lot of outrage because the way this bill was being framed was, first of all, you're giving adolescents free access to contraceptives, and then on the other hand, you have women who will be allowed to have abortions whenever they want. And then people started coming up and saying, oh, we want to protect life, and we want to, so they're trying to appeal to emotion. And then on the other side, the people who are arguing for the bill were saying, oh, there's all of these statistics that show how many mothers are dying or how many women are dying from unsafe abortions on the other side. And then the way they're presenting this data was I think it was about 7 women a day or something. That's how the stat was being shared. But then it wasn't being made as personal as the people talking about the bill essentially making every, coming and shaking the very foundation of people's religious beliefs. So just trying to understand the context in which information is being shared, and then the framing as well, so that when you're responding to it, you're responding to specific points instead of just saying, the bill doesn't say this, it actually says this other thing, and then you try to move your audience to see the points that are being made, but then you're not really addressing their fears. So what, and then because health and anything related to health is deeply personal. So that's why a lot of this misinformation can have some really drastic consequences. And I think one of the things that fact checkers and people working in this space to contain and debunk false information need to understand is that if it's something that speaks to me, if it's something that's deeply personal to me, then I will get the motivation to do something about it. So make it make sense to me in my own context, yeah.
Can I ask a question? Or maybe throw in something? I mean, Kat, you mentioned something. I hope I hope I got it right. That one of the ways that they're trying to moderate content is by limiting the power of the influencers. And I'm listening to what Mugendi is saying and referring, I mean, just taking into my head whatever we were saying earlier, where the bishops and their, the bishops, let's just use the bishops, the religious fanatics and their misleading information and totally misplaced, gets to be the one that gets to be number one. The work that the fact checkers have done, the doctors have done, actually doctors arguing from a point of knowledge, knowing 7 women are dying every day because of unsafe abortion, gets to be number 10 in that list when I do that. And I'm wondering, because if they're trying to limit the power of the influencers, I'm seeing a scenario where in situations where the influencers, they are not necessarily religious, but they are the ones fact-checking organizations or fact checkers can actually use, we can use influencers to pass on the good news, or the good story, or the good information. And if platforms are thinking of minimizing or reducing the power of the influencers, then in that process, you lose the power that you have of making the facts hopefully run faster than the misinformation. And because, okay, I'm thinking in terms of our context where, because I know Mugendi and we believe Mugendi, you know, like the bishop who died recently, we believe in him. Imagine if you had him or her, sometimes it's a her, who has all these people who, when he says jump, they only ask how high. They don't ask why are we jumping. And they are so powerful in their own spaces. If you got them on your side to push the information you need to get out to the people, to be the ones to be like the, what do you call this thing you use for in loudspeaker? Because I'm thinking in some, maybe in some societies, but I'm thinking in our part of the world, having people in your corner, having influencers in your corner, and please note, we are not paying them, but we are making them feel it's part of their CSR, if you wanted to call it CSR, but then you hold them up there and tell them you're a good guy. Imagine how many musicians and how many people follow them. Imagine if they came onto the side of the doctors and said, or even for the LGBTQI community and said, by the way, this is what we're for, and we're for this is the fact. No way, no left, no right. This is just the fact. And if the platforms start limiting the power of these influencers, it means they are taking away the ability of people in our part of the world to actually get the right information. Because let me tell you, we are not going to see billboards. We are not going to read Twitter. We believe what this man says, and I'll get it shared on WhatsApp. So if I can get this person on my side, or if I can get this organization on my side to help me push the truth out, it means that influencer has served his purpose, much more than just being an influencer of 2 million people, actually being part of the public service we are all trying to do as journalists, as CSOs, and everybody else. And if platforms start limiting their power, you need, obviously there are issues who's going to identify who is a good influencer, who is not. But we can be able, and even platform, don't ask me how, but I'm just thinking wildly here. We can be able to get the influencers if they realize that, oh, Twitter is giving me, I don't know whether it's whatever they want to put it on his Twitter handle, everybody knows he's a good guy, whatever. A reward system, not money though, not money, no money, no money, no monetary, whatever for this, because that is my one concern. And then the other thing you mentioned about is you're talking about the appeals processes. Me, I know, appealing to the platforms when they're pulling down content or flagging content, which is true, but because I don't understand what their reasoning is, and I wish I knew. I have a case in point, and I know I asked Mugendi for help on this one, where there was, it had nothing to do with my project, and it had nothing to do with public health, but it's an example where we had misinformation about what was happening in Tigray in Ethiopia, and it had gone viral, and it was pointed out, and I was trying to help somebody, and I know I reached out to Mugendi, and we all tried to do what we could to get it flagged or pulled down, and it took us forever, and it never got, because we were being asked, who are you? Okay, I'm Catherine. Who is Mugendi? He's Mugendi. Who, I mean, in terms of stature, nobody knows me in the world of Twitter, in the world of Facebook. And by the time we were given the runaround from here to South Africa, to West Africa, we almost went to Silicon Valley itself. Nothing happened because there is, you know this is wrong, and we all know it is wrong, and we pointed it out on our small tweet, let's just say our small tweets, but the platforms don't pay attention. And I ask myself, who is moderating and what is informing their moderation? And if I see they haven't done, or they haven't flagged it or pulled it down, or they are not doing anything. And public health is important, but we are talking here about a matter of real life and death. People are killing each other. What do we do? Because for me, that is the biggest challenge. Over and above, we can do what we can within our small spaces, but when platforms are not responsive and they're making decisions without letting us know what is the criteria, what it is, then we ask ourselves, then what? And then the response is like, okay, where do you come from? Kenya, forget. We deal with Americans first, and then you come maybe down the road somewhere. Prioritization, yet I'm being given advertising targeting me through Twitter or Facebook because I'm in Kenya, because the algorithm tells the platform that I'm in Nairobi. So they'll just give me advertising for Nairobi in my hood. But yet they don't respond to me when I'm saying, wait a minute, you're lying about what you're saying about this, because I'm here and I can see it and I can tell you it's not true. Then I become a small person. I mean, there has to be a kind of a balance here in terms of the responses, in terms of how do we get heard and get things that need to be flagged or pulled down or whatever else needs to happen, or even get me off the platform, because there's so much that is not happening. The third one, final, I'll shut up after this. Algorithms don't know me. They don't know me because, and me, my little understanding of algorithms, it means you feed it a lot of data, machine learning, manenos, a lot of things. When is this algorithm seeing me? And I mean not me, Catherine, but people like myself, because they don't understand my language. My English is English, not English British, not American, not Irish, not Australian. We have what we call Kenglish. But we are talking on Twitter, we are on Facebook and all these platforms, but we are not using what you'd call standard English. But that English is English. We are communicating. You understand, but the way I say the way I compose my sentence or even use a common English word is not, for you, it's nothing, but for us, we know what it means. A good example is this recent nonsense about when Kenyan women were talking on Twitter about actually you're talking about birth control, and then there was all this noise about, oh, if you're on birth control, the COVID vaccine is going to be whatever. The conversation was fantastic until some foolish people joined the conversation, and then it became, they started calling the women who are who are having this conversation, giving them all manner of bad names. And then it went into what I call dark spaces, which means they went into Sheng and Swahili. And they started calling these women Malaya. Malaya is Kiswahili for prostitute. Now, in English, if you call me a prostitute, nothing. But in our context, if you call me a prostitute, I think that's a huge offense. I mean, it's like very derogatory. Using the Swahili word makes it even worse. But it was allowed to continue and nobody bothered. The party got darker. The conversation was, everybody stopped talking about birth control. We were talking about, actually the issue here, we were talking about the issue of reproductive health and what does it mean now the bill has died and all the rest of it, and why we need, and then people are asking questions about the reports, the side that were saying that if you're on contraception, if you're using birth control methods, you might be able, some pill or the pill or something, you might have a bad reaction when you get the COVID vaccine. It was a very genuinely, how do you say, we want to understand, and people are sharing links. This is what the study has found. There's only one out of I don't know how many people, women, and all the rest of it. It just got darker, but nobody bothered to do anything from these platforms. And that means you shut everybody who was having a very fruitful and discussion, not necessarily, the conversation ended because it got dirty and it got darker and nobody was doing anything. And there's just so much that you can do as an individual, you can do as a group, unless of course you want to start raining on everybody. Raining on everybody means mobilize the Mugendis of this world, the Arias and everybody I know, and we start hitting back at these people. But then how often and how long can you do this? Yet we are being told, Kat, you said, some of the content moderation means using algorithms. It means also flagging and all this. At what point do we stop this struggle and it stops being a daily struggle to try and get content flagged, pulled, or whatever? What are the content moderators, or what are the points of, at what point does moderation about issues that matter to us, not the whole world, not the Americans, not the Indians, not the Asians, nobody, just us as Africans. When does that come in? Where are we in that hierarchy? And remember, we are in many languages, almost 3,000. At what point are we talking to who? And do we understand the nuances? When you pull out, because I said prostitute, because that's an English word, you don't pull out when I say Malaya. How would you know? I know you don't know. You know, I'm sorry, I'm using you, not you. You know what I mean, the platform. Anyhow, I talked too long. Thank you.
Well,
I think you raise a
just
lot
to
of
comment.
really, oh, sorry.
Yeah, just to comment, I think Catherine is addressing a very key point, and that's the fact that a lot of our platforms are not, they don't understand nuances of context. So, and I guess that's where the big part of the problem is, because if it comes to this, to our context here, someone will say, you know, LGBTI people are causing COVID, and their comments and the stories will just keep on flowing. And the minute an activist responds to that, you somehow get flagged and you're taken down, you wind up in Facebook jail. So that aspect of one, basing a standard on one, either humaneness, because that's like a universal standard. So if someone is saying, you know, a child should die of because she's carrying a pregnancy, then on a humane standard it will be, this is wrong from a humane standard. So this post should not fly, whether it's being raised by a religious leader or a prominent person or a president. In the case of the Tanzanian president who had this whole case against pregnant schoolgirls, like going after them, like, well, that was a really sad case. But yeah, the platform should be able to stand up to, I mean, they stood up to Trump after he became not a president, but what standard are they using? So one, using a humane standard, two, understanding nuances for the region. So saying this is the context, this post, based on this regional context, this post should be taken down, and seeing non-arguments for what they are. Because when people say, oh, it's uncultural for abortion to be discussed, but the people saying these are being funded by, you know, Citizen Go, which is a Spanish anti-rights group, then you should be able to say, oh, this is no longer a Kenyan cultural discussion, it's an anti-rights campaign camouflaged as a cultural discussion. Yeah, so those would be my 3 points.
Yeah, I think you highlighting that it comes down to context is so important, because, you know, really COVID-19 has provided this like very concrete example where we see, you know, what is possible, but that's only when, you know, large, broader intergovernmental organizations are referenced, and not the important kind of localized nuance that makes the intergovernmental organization recommendation that you should stay 5 feet away or 6 feet away from each other relevant in multi-generational households with houses close together. So what does it look like to contextualize? So we do only have a couple of minutes left, so I might ask everyone for their, you know, TLDR high level thoughts on, you know, really what is something that the platforms could be more transparent about with these processes, or an opportunity to integrate civil society, you know, so that we can advocate around that. So I might do the circle again. This time I see Kat first, then Aria, then Mugendi, then Catherine, and we can close it out. But we've got 2 minutes, so let's do this.
Okay, great. Well, one, I'm seeing a lot of partnerships we should be doing right now, but I see a lot of social media companies engaging with civil society groups individually, and I think there's something really powerful about this kind of union of civil society groups that can say, none of us have seen this, none of us, you know, have seen like the measures that, you know, Facebook or social media has ostensibly done. And I think, you know, these platforms are still operating in a way that they have for a decade, which is thinking of this global universal idea that is clearly of, you know, of what problems are, that is standardized through like the US context. So thinking like, what are the standards that we have in these local contexts that we can enforce so that we can scale in this context that's not just the US context, I think is really crucial. And like, yeah, figuring out ways to collectively advocate in ways that are much harder for organization or for these social media's companies to ignore is really important. I think it'd be great to think through those problems.
Awesome. Aria, you have any other TLDR?
Yeah, I think just gathering a body of knowledge, you know, like the way when you post a COVID post and there's this little snippet saying these are the facts, I would love to see the same facts happening for, you know, reproductive health and LGBTIQ realities, both like our culture. And when people say, you know, it wasn't African, I would like a snippet saying, oh, this has been here for 4,000 years. Yeah, so that kind of, so it's not just a social media platform, there's also a knowledge aspect to it.
Amazing. Yeah. Mugendi?
Yeah, I think it's important for the platforms to say what they're planning to do now that they've identified, or at least they have an example with COVID of diseases and misinformation around disease. Because even before COVID, there'd been a lot of misinformation around other conditions and other things that they hadn't really paid much attention to. And now that the problem is starting to be like become more concrete, like now that they have this level of visibility of what the problem looks like, what are their plans for these other things that exist like in the long term? So how are they going to actively address health misinformation? And then also, how are they going to make sure that smaller, like less represented communities actually have a voice on these platforms? Because we've seen a lot of action being taken for things that affect like Europe, North America, but then when it comes to Africa, Southeast Asia, and then in the Middle East, they haven't really been like quick to respond. And then when they respond, sometimes it's very ham-fisted, and it's very like it just looks like it's a last-minute thing. So they need to be much more deliberate with how they engage with people and with organizations in these regions of the global South. Yeah.
Thank you so much, Mugendi. Catherine?
Okay, okay, you see, the strangest thing is these platforms operate across borders. They don't understand borders. They don't understand any countries. They don't understand anything. But they are using, I wish it was possible that they would be able to kind of, I'm not saying regionalize, but because they exist as this omnipresent, they are not God. Anyway, they happen to be everywhere. Just being able to be more, I guess, they shouldn't make decisions out there. They need to break down, and whether it's having like regional Twitter, whatever, because you have people who can then set those standards. Because if you tell me you're doing the US freedom of expression, whatever, it doesn't really gel with us. And we understand how we navigate these spaces ourselves because we know our environment, such that if I call Mugendi or I say something, Mugendi knows, takes it at that level. I just want to go back to something I was doing when I was a journalist in the bad days under Moi. We learned how to write, and so people learned how to read between the lines. So you'd say it's a nice day. When you say it's a nice, it's not coded language, but everybody knew because we were not allowed to say certain things. So it's the same way in these spaces where we are then able to say, in our situation, when you say prostitute, this is what it means. So therefore it should be flagged. And we develop this community, I don't know what you call them, community guidelines, so that, because we understand which part of the shoe it's pinching us. So in a way, it's kind of not saying, okay, we are not taking you away from being your omniscient, omnipresent everywhere, but we need to be able to say, this part of the world, there are certain things that happen, and we need to be able to quickly flag them, pull them down, or do whatever, because that is what content moderation is, reducing harm. And that can only happen if the decision of reducing harm is being made by Aria, who knows where her side of the shoe is pinching, and Mugendi, instead of outsourcing it to somebody in Asia or Latin America, who may not understand. They may understand English, but they don't understand the context in which some of this speech is being made. That's all I would say in a short, just break it down a little bit to something manageable and manageable, instead of trying to be everything to everyone. You can't. You will fail some and succeed, and that's not fair. Anyway, sorry. Thank you.
No, that's exactly right. Making sure that interventions are localized, but also finding a way to exactly integrate and bring together civil society to create these identity and typologies of what needs to be flagged based on context specificity. And I think the pandemic provides a really interesting example of that, because the entire premise of a pandemic is that it's experienced across borders, but truly pandemics are experienced locally. They're experienced individually. Hopefully this can provide a case study of what's possible, and we can succeed across across public health topics, but also across regions in the future. So thank you for all of these recommendations. We will hopefully collate them into a document and try to come together for some collaboration and advocacy to make this system that, right now we're required to live within a little bit more equitable. So if folks joining in are able to add your contact information and introductions to the Google Doc, that would be great. And we definitely want to reach out with more folks that are interested in this topic. Thank you for staying a little bit later and for choosing to spend your time with us. And thank you to this incredible team of panelists. We admire you all so much. And this is an incredible discussion. Thank you, thank you, thank you.